Good afternoon. Thank you for inviting me over.
Is infertility a disease?
I think it depends on what your definition of disease is, but certainly fertility and fertility problems will cause serious psychological distress and upset for couples. It will affect how they function and has in many cases, a treatment that can cure that problem.
So it's not purely a physical condition. It does have mental
in terms of,
implications.
Probably the mental implications are huge with fertility issues. In many couples, it will affect their relationship. It will affect how they manage to function at work. It will affect how they plan their lives. And it is the mental side of fertility problems that is probably the most difficult thing to deal with.
We had one quote, a disturbing quote, and of course, unless you're in this sphere, it won't mean much to you, but friends almost ostracized us. It's a broken barrier that's difficult to overcome. Unless people are interested in fertility issues, they don't want to speak about it. Sound familiar?
I think that is very familiar, yes. It's always very difficult for couples who are wishing to have a family. They have peer pressure, their friends are having children. They can't join in the things that their friends do with their children because they haven't yet been able to found a family. They get pressure from their own families and parents, and it is very difficult to discuss fertility issues. I think perhaps slightly less so now. Fertility treatments and discussion about fertility problems perhaps is a little bit wider spread than it was. But still, we're in a situation now where 20% of women in our generation will remain childless, and not necessarily of their own volition, as opposed to our mothers. In their generation, we only had 10%.
Can I mention that? It's so the incidence of infertility is growing.
Yes, it is. Yes.
Why?
Partly it is because of socioeconomic changes. It's the ability to use contraception, to be able to delay family until later. And that is the big issue. Women's fertility will start to fall from the age of 30. And we are now at a situation where more than 50% of women having children are actually over the age of 30. Whereas, again, a generation ago, women were having their children in their teens, their early 20s, late 20s.
So the paradigm is shifting socioeconomically, socially. Things are changing. And, of course, something nobody ever planned. It just happened. It's the way that life is nowadays. And, of course, you must deal with women from right across the spectrum socioeconomically. You'll deal with people who are not terribly well off to extremely well-heeled ladies as well. It doesn't discriminate, does it?
It does not. It certainly does not discriminate at all socioeconomically. I think perhaps there is a tendency for more problems to be within the higher socioeconomic class. There is a socioeconomic advantage to delaying having children. It allows women to be able to progress more up their career pathway, to become more financially dependent, and therefore they will choose to delay having children.
Remedies for infertility?
It depends what the cause of the problem is. The easiest remedy is not to bother with contraception and have children when you're in your teens. But in terms of avoiding fertility problems, then yes, you've got to look at lifestyle, smoking, alcohol and drug issues, sexually transmitted diseases. So there are preventative measures, and that's where education, certainly in schools, is something that should be very important. But very much the age is the issue.
Why booze and cigarettes?
Well, certainly we know that they are toxins. In terms of male factor problems, they will damage sperm production. Binge drinking, especially with alcohol, does have a significant impact on sperm production. And those are the main problems. And we know that the chemicals in cigarettes, again, they will kill eggs, they will kill sperm.
Incidence of male infertility, is that going up as well?
The incidence of male fertility problems does seem to be going up, yes, and we're not sure why sperm parameters are worse than they used to be. People are saying, well, is it due to estrogens in the water from the contraceptive pill? Could it be due to high testicular temperature with things like disposable nappies? But we don't know why there has been a gradual reduction in sperm quality, and probably about 50% of the couples that I see, there will be a significant male factor problem.
I remember I think it must have been the 70s or early 80s, there was a scare story went around East Anglia in England that because they took a lot of the water from the rivers, that because they were using high-dose pills at that
That's
time,
right.
the estrogen went through all the processes and was taken out and back into, and that was genuine.
Yes. But again, it's probably a multifactorial problem. And we don't know any specific reason as to why we're seeing the fall in male fertility.
IVF. When did it start?
Oh, IVF now, the first IVF baby, she is now a mother herself, but we're now looking, 35 years ago?
A miracle cure.
A miracle cure, and certainly now an everyday treatment which has good success rates. We're now looking at overall success rates of treatment of around about 40 to 50%, but again, very, very much age dependent. If we have young women having fertility treatment, having IVF, we know that their egg quality is better. We know that success rates are going to be better. And the main recent advantage in IVF is also dealing with male factor problems and the ability to do sperm injection into eggs and achieve good success, good pregnancy rates.
Technically, what is the process of IVF?
Oh, technically, the process of IVF is to...
In vitro fertilisation?
Yes, What the main aims of IVF are to be able to stimulate a woman's ovaries so that instead of them developing one egg over a month, they will develop a number of eggs. We like to think around about between 8 and 12 eggs. And we use medical treatments to stop ovulation so those eggs can be harvested. And then on the day they're harvested, they will be placed with sperm, be that what we would call standard IVF, where the eggs and the sperm are just placed together in culture and fertilization occurs naturally, or if there are male factor problems, to be able to inject a sperm into an egg. Then they're cultured in nutrients in the incubator and they can be looked at the next day. You can see which of the eggs have fertilized, and following that you would continue culture, usually for up to 5 days, and at that stage we hope that we're able to select the best fertilized egg and replace one of those inside the womb. And very much now we do look at only replacing one fertilized egg. One of the main criticisms of IVF in previous years was that we were replacing multiple embryos, multiple fertilized eggs. When I first started, it was routine to replace 3. And therefore, we ended up with triplet pregnancies, we ended up with twin pregnancies, and they are far more complex pregnancies. So we do now believe the mission is one at a time.
IVF for Manx people happens where?
IVF for Manx people, we have a contract with Leeds Fertility. That is the unit where I did my IVF training. But what we are able to provide here is what's called a satellite IVF service. So the whole IVF process, from starting to stimulate a woman's ovaries, going through to the stage where the eggs can be collected and fertilized and an embryo replaced, will take place over about 8 to 9 weeks. But the majority of that can happen here on the island, the stimulation, the observation of development of the eggs, and it's not until that final part of treatment where egg collection needs to take place that couples need to travel off island to undergo the egg collection, the embryology, the laboratory work, and then have the embryo replaced before returning home.
We're talking to Dr. Michelle Moroney, consultant clinician at Noble's Hospital, obstetrician, gynaecologist, and specialist in fertility matters as well. What's the criteria for Manx women to have IVF?
Well, the DHSC reviewed the criteria in April 2017, and effectively the Isle of Man government will fund for one cycle of IVF for couples who have a 2-year history of subfertility. The stipulation is that neither couple should have children, that their fertility problem is not being caused by a voluntary sterilisation, and that women must be beneath the age of 40. The additional stipulations, which are good public health measures, are that both partners must be non-smokers. And in terms of body mass index, a woman's body mass index needs to be less than 30.
One round is covered by the Manx government as
Indeed.
well. Many people obviously then, if it's unsuccessful, do want to try themselves as well. How much does it cost? What's a rough cost?
A rough cost of a standard IVF cycle without sperm injection and including the drugs, because the medicines are probably a very significant proportion of the cost. I would normally tell couples they need to budget about £5,000 for a treatment cycle, because you've also got to factor in time away from the island, time in the UK. So those things need to be factored in.
I'm guessing, Michelle, this isn't just a job for you, is it?
No, it's a way of life, probably.
It's a way of life. For somebody you have a deep knowledge of the matter, and of course this isn't just a clinical issue. It's not a medical issue as well. You've got an insight into the way women's minds works, and probably into the way that men's mind work. At what point do you say enough is enough to a couple?
I think that's quite difficult, and it is partly because treatments have become more advanced. There are always alternatives, and I think in terms of reaching closure where treatment has been unsuccessful, it has to be a decision that is actually made by the couple. I see many couples where there is poor egg quality and stimulation of the ovaries is not good, and you know that on each occasion the success rate is going to be less. At those stages, you maybe have to then discuss issues such as donor eggs, which may not be acceptable for everybody. But you try to guide by relative success of treatment, and you do have to allow couples to make their own minds up as to when treatment should stop and they should consider other options.
We've got a question in. If the woman's trying to have a child, finding it difficult, should she stop smoking? Should she be smoking in the first place?
She should certainly stop smoking.
Why?
Because we know that the contents of cigarette smoke will actually damage eggs in the ovaries. And women are born with all the eggs they will ever have. And all we gradually do up to the age of menopause is we will lose eggs every single month. So we know that smokers will have an earlier menopause than non-smokers. We know that egg quality is poorer in smokers.
You've heard many times people saying there are too many people in the world nowadays, and do those questions ever trouble you, ever bother you when people say there are too many children in the world anyway, we shouldn't be invoking medical science to bring more children into the world? If people can't have them naturally, well, that's that.
Well, that's one way of looking at it, but no, we're certainly looking at a reduction, as I say, of more women actually remaining childless in our generation, certainly in the Western world, than a generation ago.
It's been phenomenal, hasn't it? I mean, two generations ago, women having 5 and 6 children was matter of fact, wasn't it? And and that's changed. So the Western world, the birth rates plummeted over the past 40 years. And maybe an unfair question, but do you have any ideas why that's happened?
Again, part of it is, contraception was the hugest issue. Looking 2 generations, 3 generations ago, women married, they got pregnant, they then had their baby, they then breastfed, And of course, breastfeeding suppresses ovulation. So it was a natural way of family planning. But of course, once they stopped breastfeeding, they started their periods again, they got pregnant again. And they didn't have any control over that.
So it was the 1960s when
Yes.
when the pill first
Oh, yes.
arrived. It was, well, first of all, women could have sex without guilt for a start.
Yes.
Women could enjoy their own bodies. They could have sex when they wanted without the risk of getting pregnant. So the 60s liberated millions of women in the Western world.
Yes, it did.
And that's filtering down to us now. Do people ever come to you who are on the cusp, not knowing whether they want or whether they don't want? Have you ever had somebody come in the door thinking they did and go out thinking they don't?
Not really, because by the time that couples come to me, or people come to me, it doesn't have to be couples. It may be single women. It may be women in same-sex relationships. They've already made the decision that they are wanting to have a family.
Is provision for IVF on the Isle of Man better, worse, or about the same? Scotland, Ireland, UK?
It's variable. It is very variable. And in terms of Scotland do offer more cycles of treatment, as do Wales. England, you're still very much looking at it being a bit of a postcode lottery. It depends on what funding and provision is put in by the CGCs. The one thing I think is fair to say across the board, that probably about 50% of couples having IVF will be funding it themselves.